greatly contributed to the provision of additional classrooms to facilitating access to basic education and helped to close the gender gap. Through the development of appropriate policies, the provision of sex-disaggregated data, among others. And more resources are now equitably distributed and better utilized for program implementation in order to close the funding gap.
The analysis also revealed that access was a problem. That is why the policy of education now is more on relevance and quality. But there was a time it was access, relevance, and quality. But because they have done so much in terms of access, now the focus is on relevance and quality. But yes, that was a problem.
Awareness creation and sensitization activities through platforms such as television and radio programs, as well as community meetings, have increased public interest and knowledge of girls' education. The Ministry of Basic and Secondary Education is also creating space for civil society organizations to participate in education at all levels, ranging from policy formulation and implementation, service delivery, infrastructure development, and monitoring and evaluation, just to name a few.
The mothers' clubs were formed to support girl-friendly schools. They are within the school environment, addressing issues pertaining to quality. They are provided with seed money by UNICEF. They utilize this seed money and the proceeds go into supporting the schools.
At tertiary level, the Gender and Development course run by the Management Development Institute, MDI, contributes to the building of a core people with knowledge and skills in gender mainstreaming. The university is also offering courses in gender studies.
The importance of the Gender and Development Department in MDI here stems as far back as the late 90s, when the then Director General, together with her team, thought that it was necessary to have a Gender and Development Department as a way of trying to address public demand. In as much as the Management Development Institute is a tripod in nature, running on training, research, and consultancy, it became very much prudent that in as much as it's a public sector training institution, and when you talk about the public, it has something to do with men and women, and gender is centered on the relationship between men and women.
Mainstreaming gender in public and private institutions is prerequisite for national development.
Education is something that is a means to the person's development. So if you do not have that means, therefore there's so many things that you cannot do in life. So, and that translates to the nation. So obviously if half of the population, for example, are not formally literate, it will be difficult for that country to develop, because there are so many things that we do in this life that needs knowledge and skills.
If you talk of gender mainstreaming, this is just a paradigm shift, a shift from the previous women in development, women and development, gender and development, and taking gender at a more advanced stage. Looking at gender to be mainstreamed across all sectors, from top to bottom. And by so doing, in the area of legislation, in the area of policies, in the area of programs, and many other areas, you must have a true reflection of males and females representation in what is being done. Where you even think that you have more women than men, you can also bring men on board. Right? Where you think that women are at the lower end, you can also bring more women on board so that it can be balanced. That is the essence of it, because it's like targeting all gender, making sure that you don't not just focus on one and forget about the other.
The Community Skills Improvement Project, CSIP, sponsored by the African Development Bank, ADB, continues to provide training for women and out-of-school youth with the view to enhancing self-employment ventures and entrepreneurship development.
We are not just doing literacy, like you go to the class and learn abacha, as they say, but it's like functional. You combine the literacy activities with livelihood skills. It can be tie and dye, it can be batik, it can be weaving, cloth weaving, which, for your information, women are doing through the intervention of CSIP.
The project targeted 40,000 women and youth in 250 communities, but was able to reach about 32,000, which accounts 81% of the targeted beneficiaries. The 32% of the beneficiaries are graduates of the project's adult literacy program. Health is at top of government priority list. This is what is driving the rapid improvement and expansion of the country's health delivery system, and the ultimate aim is to make health accessible and affordable.
The health status of women is critical because women are the custodians of families. Responsible, whoever is sick, in fact, is the woman's responsibility. I'm sure you know, whether it's the husband, another relative. So women have that burden of doing that unpaid job at the level of the household. So government wants to lift that burden on women and make sure that health, just like education, is accessible. It's at the doorsteps of every Gambian. You have to walk with just a few meters to be at the next school. Almost every village has a school. Just in the same vein, every village has a health facility, or at least a trekking station, or a dispensary. So that is what the government did when it came in 1994 to date. It has built the health infrastructure. You can see it. It's there for everybody to see. We only had 2 hospitals, if you remember, Bansang and RVH, Royal Victoria Teaching Hospital. But today we are proud to say that we've uplifted Royal Victoria Teaching Hospital to a teaching hospital now, rather than just a hospital. And that means it has a medical school as part of the University of the Gambia. That is progress.
Critical policy interventions have also been implemented to ensure health for all, but ensuring improvements on the health status of women and girls who form the majority of the most vulnerable segment of society.
And when you look at the other, like major health centers, where operations are done, that has reduced, for example, the referrals to major hospitals, such as the 4 hospitals that now we have. We have moved from 2, now we are proud to say we have 4 hospitals. At least we have added on, if you remember, Yorobal has been upgraded. It may not be a hospital, but it's a major facility. But Farafenye is a hospital, obviously, at Buyam. So hospitals are beginning to emerge. In fact, I'm also told by the WHO that what we call major health centers in the Gambia are indeed district hospitals in other countries. So in effect, we even have more than 4 hospitals, if you rate it at the WHO rating. So we are doing very well.
The decentralization of the maternal and child health family planning program to cover the entire country means women will no longer travel more than 7 kilometers to access health care. The Safe Motherhood initiative has served to counter risk in pregnancy and childbirth, as well as reduce maternal and infant mortality.
The development it has improved lives of people in Basse. Like we have about 7 or 8 referral health facilities, bringing patients, complicated maternal cases to Basse Health Center. It was a transit to Bansang. Now we say no to the, thanks to Allah, the government of the Gambia and then CAI of UK, that this place is in place. Instead of Bansang, they are stopped here. We operate them, save their lives, in order to help us to reduce maternal mortality in the Gambia. Our referrals, well before we start operation, were very high to Bansang. No, we have drastically reduced that.